video is going to be a little not in line with my other videos. If you watch my other videos, they're basically about nursing profession and me getting ready to go to medical school. But I'm doing this for myself and the patient, basically. Here in a couple weeks, I'll be getting surgery. And not a lot of people talk about this surgery, not a lot of people post about it because it is a sensitive area. So I'm going to be getting a fissurectomy, fistulotomy, and lateral internal sphincterotomy. So why do I have to get this surgery? Well, most people get this surgery from chronic rectal fissures. This is just something that a lot of people get. I tried to look up statistics like on the CDC and the NIH, but got a very wide variation. So anywhere from 200,000 to a million new cases a year just in the United States alone are diagnosed. So if you're watching this video, you're not alone. There's a lot of people that have this condition. Occasionally, fissures. I've had like 3 over the past probably 6 years. Occasionally, fissures will open up and create a fistula, which is essentially a track underneath the skin that often will get infected in an area like this. And this will create an abscess, and the abscess is called perirectal abscess, which is an extremely painful condition while the abscess is forming and but after the abscess is actually opened and drained. It's not very painful. It's just a chronic condition. It often doesn't heal on its own without surgical intervention. So I have, like I said, I've had 3 fissures. The last one, I guess, developed into a fistula and perirectal abscess, which I've been dealing with since September 7th. And it's now April 9th. So I gave it, 7 months almost. And I tried all sorts of non-traditional treatments. A lot of people say coconut oil. Coconut oil rubbed on that area is supposed to increase healing. I actually mix coconut oil with a little bit of eucalyptus oil, very little bit, and I haven't had any sort of infections down there. Coconut oil and eucalyptus oil do have antibacterial properties, and I've also been using bacitracin and lidocaine cream. So the open abscess isn't necessarily painful, but it can be kind of itchy and burny and stuff. So the surgery itself, there's 3 different procedures that they kind of consent you for when you go for surgery. One is the fistulotomy, which is the fissurectomy, which is where they essentially go in, remove the fissure, close it up so it doesn't reopen, hopefully. I really hope it doesn't come back. And then the fistulotomy, they essentially find the track, make sure it's not going anywhere important, open the track up and clean it out, close it back up. Occasionally, you'll come out of surgery with something called a seton drain, which is a drain that goes in the external fistula opening through the fistula tract into your rectal area and then actually out your rectum, and it's kind of a ring, and what that does is it helps the fistula tract heal naturally. I was told I probably won't have one of those, but I have worked in the recovery rooms for quite some time, especially at Duke. I worked at Duke for a while, in the recovery room, and a lot of their fistulotomies would come out with a seat and drain, and I don't know if that was just their preferred method of treatment. I'm not entirely sure. It's probably completely surgery or surgeon dependent on what they prefer. And also the last procedure is the lateral internal sphincterotomy, which is essentially hopefully preventing future fissures from happening. And why fissures happen is you essentially have a tighter rectal tone than normal. At least that's from the literature that I read. The tighter rectal tone essentially makes you more apt to tear that very sensitive tissue around the rectal opening. So they basically go in and cut and loosen one of those internal sphincter muscles, which relaxes the tone a little bit, and in theory it's supposed to significantly reduce your chances of getting another fissure. My surgeon quoted 95 to 96% success rate, so I'm hoping I'm not in that 4 to 5% that have to go get this done again. As far as what causes it, a lot of times it is constipation. You don't have to be like chronically constipated. It can just be one episode of constipation that gives you a fissure, and the fissure just doesn't heal. Somebody asked me the other day, another nurse at work, are you like chronically constipated? I'm like, no, not really. I just had, bouts here and there, and that's where the fissures kind of popped up, and it went from there. Yeah, so I'll have the surgery here in a couple weeks. I'm going to make a couple videos. This is the pre-op video. My father actually had a similar surgery back in the 90s. I'm sure the procedures are a little bit different, probably less invasive than they were back then, but he said it was fairly painful for a couple of days, and it took him probably about 3 weeks to get back to normal. But like I said, this is the pre-op video. I'll make a post-op day 0 video, which will be the video after the night after, or the night of the surgery, or whatever. After I have the surgery, the night of, after I feel well enough and sane enough, after all the anesthesia wears off, I'll make another video. And then I'll do like post-op day 1, 2, 3, and a couple weeks out. So I'm hopefully going to give people who are having this surgery an idea of what to expect. And also you can ask questions if you want. Like I said, I am a nurse, so I can answer a couple medical questions, but I'm not terribly familiar with this procedure. I have recovered several patients who have had this procedure in the post-anesthesia care unit, and they have ranged from completely comfortable and discharged in 15 minutes, 30 minutes from the PACU, or they've been in a lot of pain. The most of the people that I recovered who are in a lot of pain, this was a chronic issue, and this was like their 3rd, 4th, 5th surgery that they've had to correct these fissures and fistulas and perirectal abscesses. But yeah, so I'll get this video up a couple days before surgery, and then I'll make a couple shortly after, and hopefully it'll help a patient or two down the road feel a little bit more comfortable about the surgery. This is my first surgery, so I'm making these videos to make myself feel more comfortable. So yeah, I'll talk to you guys later.